We are going to be looking at two different slides, but the focus of this video is going to be hypochromic red blood cells. So hypochromia, when we are looking at a peripheral smear, is based off how much hemoglobin we see in the red blood cells. And we get an indication of what we're going to see on the slide by looking at the hematology analyzer printout and looking at the MCHC, the mean corpuscular hemoglobin concentration, which normally is 32 to 36 grams per deciliter. So if we have a value that is under 32, we can expect to see slightly hypochromic, or I guess if it's really under 32, severely hypochromic red blood cells. So on this slide, we have a normal patient. So I'm expecting that if I have the hematology analyzer printout on this patient, that it would be in the normal range of somewhere between 32 to 36. So you could see that these red cells, normal red cells will have what's called the central pallor. It's that area in the middle of the red blood cell that's slightly lighter in color or kind of whitish. And basically, that's where the nucleus used to be when it was maturing in the bone marrow. So that's perfectly normal to have. So these all look like really great healthy red blood cells. Okay, now if I put on a slide of somebody that has an decreased, let me find a good spot here. Sorry, here's probably driving your eyes insane. There we go. Okay. So what I see in this field of view, as far as the hemoglobin concentration, is I see red blood cells with an increased central pallor, meaning that white part of the inside of the red blood cell is slightly bigger. Now, I wouldn't say it's grossly hypochromic, but certainly, especially that larger red blood cell in the middle and the one below it, you can see that the central pallor is definitely bigger on that one, and overall, it's bigger on a lot of the cells in here. So, yeah, these are definitely hyperchromic. I would say 1 to 2 plus hypochromia on this particular slide.